Hi, my name is Mike Pekarsky. I'm a doctor of physical therapy. I'm going to show you some basic ways to tape the finger for Brazilian Jiu-Jitsu. So the two most common ways that people hurt their fingers is their fingers will get hyperextended or bent the wrong way like this. So hyperextension is resisted by a ligament that lives in the front of the finger called a volar plate, while side-to-side motion is resisted by the collateral ligaments, which live on the side. So when I do taping, it's going to be to prevent those two motions. So I initiate, you can take a tape, you want to use something about maybe half a centimeter or so, and we start by making anchors. So I'll make an anchor like this. So we start with the anchor. Now, to prevent this hyperextension, I want to make X's specifically over here because I want to make sure I'm only resisting this extension as opposed to bendings, because I want to make sure you can still grip. So I come across, you can see, is I'm going to start making X's. Make sure that you're not putting too much pressure because I don't want to cut off the circulation of the finger. And I'll show you a quick test that we can do afterwards to see. So as you see, we're making this little X. So I can still make a grip, but it's going to protect against this hyperextension. The second thing I want to do is a buddy taping. So this will prevent this side-to-side motion. It'll protect those collateral ligaments. You have to remember that these fingers are different lengths, so they bend differently. So you want to make sure that when you anchor them together, they're in a way that it won't limit the motion. So if I do my second and third finger, I'll do something lower here, like this, and then maybe one above the joint up here. And again, you don't want to do too tight because I want to make sure that my fingers don't lose circulation, like this. So right now, my finger is in a position, there's no chance of it bending side to side, and it's not going to be able to hyperextend. I can still make my grips, so if your game is reliant on a lot of grips, you'll still be able to do it. And to check for circulation, again, what you can do is take your fingernail, press in, and see how long it takes for the blood to come back. If it takes more than 4 or 5 seconds, you might have wrapped too tight.